Hello, everyone. How are you doing? If you're new to Life's Dilemma, welcome. So, today I'll be discussing about premarital checks. So, premarital checks. So, why have I decided to choose this topic? um, Basically, what is happening is that most so often I find that couples will wait till few weeks before their wedding, then they decide to have this check, and lo and behold, some people are not as lucky, with a lot of dilemmas on how to proceed the relationship, or if because some of the checks brings out surprises, and some people are lucky they get away with it. But I think to be safe than sorry, it's wise to have these checks done. So when the relationship is defined from friendship to dating, then I think it's wise to have these checks done. So is this is very important to know this medical aspect of the relationship. This will help you to make informed decisions, and in doing that you would need to go to the hospital or clinics to have these checks done. Most of the time it's some of them are blood tests. Some of the tests that you do is HIV, hepatitis B and C. There's herpes, there's syphilis, there's warts, there's the rhesus factor as well, which is either positive or negative. Also, there are mental health condition checks that you have to also do, which runs in family. Something like bipolar. There's also fertility tests that you have to do. So you have to check the viability of the eggs and the sperms. And some of these fertility issues runs in family. And obviously, this makes them not very fertile. And if it's not fertile as well, they are not active as well. So also genetic diseases like sickle cell, which creates a lot of issues in our communities. And what happens is that most of the time you have couples who have the sickle cell traits. So they don't suffer from it, but they are very recessive. And if two couples who are AS have children, let's say they have four children, out of the four children, one of them would be normal. The two of the children will be carriers like their parents, so they will be AS. The fourth child would be an S, which they tend to suffer, and they would have to visit the hospital so often. And normally you don't know at like which order the child becoming. It could be your first child who will be the sickle cell sufferer, and are you prepared to go to the hospital like every month to to help a child who is in pain all the time? And are you emotionally ready for this as well? So I think it's wise to have these checks done, and so that you don't put yourself into any emotional stress. Story that I heard about a couple who went on. Obviously, they found out later in their relationship that they were both AS, and they went on to get married because they couldn't, they couldn't break up. And what happened was that in their first child, they had to have an embryo check to make sure that the child was not having the sickle cell disease itself. And it was so emotional for them because they have to do all these injections. You have to spend money to do these checks, and the emotional stress that come with it. They realized it was more than they had settled for. The emotional stress was too much, and luckily the child was okay. So they had the baby, but then they had the second child, which was unplanned. And the woman stated how the 9 months was the worst time in her life because the emotional stress of not knowing if the child was, a sickle cell or not. And it's so I feel that if she knew what she had got herself into, she knew the extent of the emotional stress, she would have actually would not have gone into the relationship. But obviously she wasn't prepared for the emotional roller coaster that she was going to go through. And it takes a strong person to be able to go through it, especially those who have sickle cell children. The child will always be in pain, and you have to go to you'll be visiting the hospital all the time. And sometimes, so that's why some of these checks are very important. I also have a case where there were two couples who were not who went to have the check done, but unfortunately one of them had HIV, and they were puzzled because they were not sexually active, and they wondered how they had it, not knowing that the guys, one of the parents had HIV and had died of it. But obviously they wanted to be, there was secrets around it, so the child was not aware. So when they started the relationship and the girl rightly asked for a check, them to have a medical checkup done, that's when they found out that he had the HIV. And actually, the long of this story is that the girl decided to stop the relationship because she realized love was not enough. The emotional stress, the stress of not knowing if she'll bear a child who has the HIV or not. She knew that there were a lot of medical interventions which could prevent the child from getting the HIV as well, but she couldn't cope with the stress, so they broke up. And so a lot of breakups happen because people are not emotionally ready for some of the dilemmas that they would end up with. Of contraceptives, there's the male condoms, which most people know, but the ones that they don't know is the female condoms, which I encourage women to use, especially when they have husbands who are sleeping around. It would be good to have these female condoms to protect yourself. Also, there is implants, which goes in your arm, and there's also the IUD, which goes inside your vagina. There's also the pills that you could take. So these are all form of contraceptives that I advise that before you go into marriage, you should have one planned up so that you prevent any unwanted pregnancies. If you're a young person watching me or you are a parent, it's very vital to advise your child to have a form of contraceptive before marriage. And I feel that this would help you not have any unplanned pregnancies. I know most people complain, oh, I'm going to get fat, but it's better to, you know, get a little bit, have a little bit flesh than, having an unplanned pregnancy, which is more hectic. And also, I feel that if you have a contraceptive in place, it gives you time to make sure that the partner that you have is actually has the characteristics of someone that you can have children with, because sometimes people tend to mask their characters. And character is like pregnancy, and it will definitely come out. And in not rushing to have child with that person and you're stuck with them for life, it gives the contraceptive gives you time to study the person. And obviously, if they have a motive in getting into the relationship, you'll find out within the year or two, you would have figured out who the person was. Are they exactly what they said they were? And in doing that, you could make an informed decision if this is the person that you want to have a relationship with, and is this the person that you want to be the father of your children or the mother of your children. So I think it is very vital to have a contraceptive in place so you don't get trapped into having a child with someone that you would live to regret. So it's so vital that you have time to study the person, and within the 1 to 2 years, you are able to observe them very well and unveil all the characters, because they can't hide it for that long. They might be a super hider. I think if you're not able to reveal their characters within 1 to 2 years. And so this is the trend I've noticed, that every time I see people within the first year having children that quick, most of the time there is a motive, and please don't get trapped into these type of motives. So give yourself time, use the contraceptives until you are 100% sure that the character of the person you are married to is the same person you are living with, and that, because it's not everyone you have children with. And so this will give you time to make a decision. Well, this is all I have to say about the premarital checks. Stay blessed, and bye.